And go
I
Michigan
was
State.
in a meeting by myself, clearly, but
Yeah, okay.
good afternoon. We are here. This is the Mental Health Parity Advisory Committee meeting. It is March 27th, and this meeting is being recorded. Welcome, everybody. Thank you for waiting for me to catch up to get into the right meeting. I'm going to do roll call quickly. Dr. Fowles? Carrie Steving?
Here.
Kathy Busby?
Here.
Monica Curry?
Here.
Jessica Thompson?
Here.
Benicia Hill? And I know Nicole is on. She's having trouble getting in, but she is also present. So glad to say we have quorum today. So that's wonderful. Let me post the agenda. Can everyone see the agenda?
Yes. Yes.
So for vacancies, unfortunately, I got 2 more vacancies this week, early this week, from Carly Fleege as well as Melissa Salazar. So we have currently 4 vacancies on the committee. 2 vacancies are for family member representation. 1 vacancy is for an insurer, someone from the industry. And then the last one is for a representative from an inpatient psychiatric hospital. So if you know people, or if anyone's interested, or if anyone from the public is listening and you want to join the committee, please email me and I will go over further instructions with you. But those are 4 vacancies that we have available. Any questions?
Could you perhaps just send out those to us, like in an email, that these are the positions? So
Yes,
because otherwise I'll forget.
I can definitely do that. I've sent out some feelers, so I'll send you that scripted email. I'll have that out to you after the meeting today. Also, moving on to media update. Share with we've made a couple of updates to the website. So I'll share that. Nothing major, but to help keep up with some of the information that is going on. So can everyone see the website?
Yes.
So when you come to the Mental Health Parity website, here's the landing page, and we have different tabs. And down at the bottom, I asked to add a tab for news because I realize stuff is happening fast and furious and want to try to keep up with it to keep everybody informed as much as possible. And so over here, if you click this, I try to keep updates with the current trends. So there's the DOL report, the peer report came out. So that's the newest thing. So when you click that, it goes to the report. Kind of do a 2-in-1. So this came out January, and it's pretty robust. Had some very interesting information in it about what they've been seeing in trends for MHPAC from a federal level, which I'll go over when we get to that section. But just so you know that there's a place where you can keep up with news. So if they make any changes to the final rules or roll back anything, you will find it there, and the public can find it there as well. So make sure there's any questions on that, or if you find something that's relevant that you think should be added to news and trends, please email it to me. And if we think it goes there, we'll put it there. Just again, we want everyone to stay informed, public and industry, on because things are happening very quickly. Any questions on that? Okay. Josh, it is on you. I can make you the co-host if you want to manage your slides. Let me do that. So you should have the ability to share right now. There we go.
Okay, is everybody looking at the slideshow there?
Yep.
Yes, we can see it.
Perfect. Awesome. Okay, well, welcome everyone. I am Joshua Stegemeyer, and I am the State Suicide Prevention Coordinator, and I'm here to give you a brief update on what we're doing, as well as a preliminary look at the 2024 suicide data. The data that I'll be sharing concerning 2024 is provisional. That means it's not been finalized yet, but it's been reviewed to a point where they're comfortable sharing it for sort of preliminary purposes. So without further ado, got our agenda for today, and then we'll go ahead and get started with our data update. So I'm going to orient you to the slide here first. The table on the left compares Arizona suicide deaths and rates of death to the national rates of death and suicide deaths. And the table on the right shows it by breakdown of decade of life. So we're going to start with the table on the left here. And you can see that it starts in 2018. And we've got our column for deaths, but we also have our column comparing Arizona to national. The numbers in the red represent our state, and the numbers in the blue represent the national rate there. And just for context, if you're not used to dealing with rates of something, this means the rate of something happening per 100,000 of population. In this case, death by suicide. And it's useful, this particular statistic is useful for comparing populations of different sizes, that is apples and oranges. So it gives us a basis to compare Arizona to the rest of the nation, for instance. So as you start to look at these numbers, you can see that we're significantly higher than the national rate, but that our rates have been declining since 2022. Right, and that's kind of the important part of this slide, is it's showing that since kind of the back end of COVID, we've been reducing our deaths by suicide here in Arizona. Even though we're relatively statistically the same between 2023 and 2024 with the number of deaths by suicide, our increasing population is, making sure that that rate is lowering. Okay. So while we still have a lot of work left to do, we are getting better. Now, just one caveat here, we don't have the rates available for 2023 at a national level. Those were not finalized. And then obviously we don't have the 2024 rates either. Okay. So going over to the graph table here on the right, we have our numbers compared from 2023, which in the normal font, and 2024, which are bolded. Right, and some key observations from that table on the right are that young adults 18 to 24 experienced a significant increase with deaths rising as well as the rate of death rising. Older adults, on the other hand, saw a dramatic decline from 2023 to 2024, with the rate dropping from 42.4 to 25.3. So that's good news, even though those numbers are still higher than our state average. The middle-aged groups continue to have some of the highest rates of suicide. And so you can see that there with the later decade of middle age and the approaching retirement decade there, 55 to 64. Both of those decades have gone up. All right. So we'll move on here to our next slide. This is where we start to talk about deaths by select demographic. Okay, so again, we have our 2023 numbers in the normal font, and 2024 is bolded. So these numbers reflect, of course, our ongoing need to be able to support specific populations in order to understand how to do that and to see these disparities among the different communities. We collect this information and right here are reporting it out. So this is what allows us to really get down into the weeds with our targeted efforts, right? So some keynotes here. Starting a trend that's been going on now for about 5 years, the reduction in American Indian and Alaska Native deaths by suicide. So while they still remain our highest racial and ethnic group for death by suicide, the steady reduction over the last few years has been encouraging as the efforts both for on tribal nation land, but also for the urban Indian community continue to reduce this rate. But on the other hand, the next category down, the Asian American or Pacific Islander community, we need to do some more investigation there because they're normally one of our lowest risk groups, but you can see there the level of increase that they had between 2023 and 2024, their rate more than doubled. So while they still are below the state average and right in line with the national average, it's concerning to see their rate jump so quickly. A trend that we're happy to see kind of reverse itself, though, is the next line down with the Black or African American residents in Arizona, which for 5 straight years that number had risen and going from, like the Asian American or Pacific Islander community, one of our lowest risk populations, to being above our state average for the first time in a long time. But like we said, we're happy to see that trend look like it's starting to reverse itself in 2024. So we have a little bit of a reduction in our wider Caucasian population and a little bit of an increase in our Hispanic or Latino population. Not to be unexpected because we are statistically similar with last year. So some encouraging news on the veteran demographic there. You can see that it continues to reduce itself. And that trend continues over the last couple of years. It's really hard to get an exact number for the veteran population, as we know a lot of veterans don't like to be identified, especially to state and federal government. So we do the best we can, and I work with the VA's estimate of our population here in Arizona, so at least the numbers are consistent. Going down to our bottom category there, we do not, as a state, collect information on the death certificate as to SOGI, sexual orientation, gender identity, and expression. It's a binary male or female on the death certificate. So we do not have any information available as to deaths or rates of death for the LGBTQIA2 spirit plus population. So I include them though because every bit of national data that we have shows that they are 5 to 10 times at greater risk than the sort of centerline population. So those who don't identify as LGBTQIA2 spirit plus. So it's important to remind everyone that while we don't have the Arizona specific data, these are people that we need to be thinking about in our planning and policy activities. Okay, I'm not going to go through everything on this slide, but this is our geographic slide where we start to break it down by county. So you can orienting you to the slide on the left there, we have a number of deaths by suicide by county. On the right, we have the rates of death by suicide per county. And then in the middle, we have the table that represents that data. So just a couple of highlights here. It's a really good piece of news. If you look at Cochise County, they were able to cut their deaths by suicide and their rate per 100,000 in more than half from 2023 to 2024. So that's super encouraging news. Our lowest rate in the state, though, goes to Yuma, which is just a really great story considering where they were at a few years ago. And to see them have the lowest rate in the state, and to get below or around the national rate is very encouraging. So I wanted to highlight Yuma and Cochise County. We can see that some of the other counties are trending up a little bit. That's what that burnt orange color is that the numbers are headed in the wrong direction. but still there's some good news in there too. If you see on there those white lines, those are either statistically the same or they are suppressed. And because of data privacy, we suppress that information if there's less than 6 suicides in a particular county. So you'll see that reflected on the actual pictures of the counties. There'll be a little less than 6, and on the table there's an S there where we've suppressed that data. And these slides are available to be sent out in the follow-up, so everybody will have this as well. Okay, getting into syndromic surveillance. This is more of our actionable data, right? So orienting you to syndromic surveillance. This is a real-time public health monitoring system run by the CDC. Basically, all of our clinics and hospitals in Arizona that participate send their data to the CDC, and then we're able to look at it in near real time via our data visualization dashboard. Now we have over 90% participation in our state from hospitals and inpatient clinics, but there is a very important data gap in that we only have one IHS 638 facility reporting from tribal nation land. So while these numbers are pretty accurate for a big chunk of Arizona, understand that we do have that big gap on tribal nation land. So just taking a look real briefly at these numbers, comparing them from 2023 to 2024. Ideally, in the short term, these are good numbers. I mean, they're still higher, obviously, than we'd ever want to see. We want 0 in all of these categories. But in order to see if our suicide prevention efforts are having an effect, ideally what we'd like to see from one year to the next is a reduction in emergency room visits. And that's what we see here, right? But if people are not going to the emergency room, because we don't have any more providers, or at least not very many providers more than we had last year, sometimes they go to inpatient care, right? And so when we see emergency room numbers reduce, sometimes in the short term we see the inpatient numbers increase, which we saw that a little bit here in the course of last year to this year. So the numbers are kind of doing what we want. They're not reducing as quickly as we want, but we are seeing the trends that we'd like to see to indicate that our suicide prevention efforts are having an effect on getting people out of the emergency room and directed more towards the appropriate level of care. In the long term, we'd like to see both sets of numbers reduce because more people are getting into peer support channels or actual psychotherapy. Okay. Let's see here. And talking about or starting to talk about the crisis system, I'm not going to go into too much detail here because I saw on the agenda there's a crisis system update right after me. But I do kind of want to point out some of the interesting things that I see here. These numbers are just a couple of days old. I pulled them for this slideshow off of Solari's public dashboard. But you can see, well, this first slide here depicts the state crisis line. The next one will depict 988. So the state crisis line, you see that social concerns are the top. They've topped self-harm and suicidality by 6%. All right, and this is a trend that has just started here in the last couple of months where certain things are jumping in the reasons for calling. For instance, anxiety, and sort of specific symptomology has jumped, like psychosis and anxiety, you can see here, are much higher than they were a couple of months ago. You can see too that the calls spiked in January up to about 42,000 and they dipped in February down to about 36,000, that they're back up now in the last 30 days to 41,000. So we've had some probably larger fluctuations than I've ever seen since I've looked at these numbers over just the last couple of months, right? So you can see the information on the different referral sources, mobile team dispatch and such, and you'll have this to review when the slides go out. Starting to look at 988 data, we start to see the same sort of trends reflected there around social concerns as well as suicidality. I'll say that for 988, suicidality was the top reason for calling for quite a while. But again, you see social concerns start to jump to the top, and depression and anxiety specifically rising, and then you also see psychosis there in that mix. So shuffling up of the reasons for calling in the last couple of months. You also see too that well, the bump in 988 traffic isn't as dramatic as it is on the state line. There's still more traffic coming in, and it's been unpredictable over the last month or two. One thing that's interesting about the 988 data is that we have utilization by county. And so if you look at, you know, sort of the numbers around Maricopa, Pima, and decline to provide, you'll see that the message or the calls aren't coming in from the rural counties. Whether that's an indication that we need to do more outreach or just that there's some other factors at play, we're not quite sure yet, but that is an interesting piece of data.
Joshua? This
Yes,
is
go
Mary
ahead.
Kuczynski. I hate to ask a stupid question, but what is social concerns? What is the motivation under that category?
Well, and I'm not sure if we have somebody on the line from Solari that could give the exact definition, but my understanding is those are concerns related to sort of your social circle, the people you know, and your interpersonal relationships.
Thanks.
All right. So let's see here. So that is a brief look at some of the data that we have coming into us at the preliminary level, that provisional level. So if you have any other specific data needs or data asks, just please get in contact with me and I'll see what I can do to provide those. But some of the other things that we've got going on, I just talked about sort of the penetration of the state crisis system into the rural areas. Well, one of the efforts that we have to kind of increase that is our rural mental health hotline here, the AgriStress hotline. And this is new to Arizona through a collaboration from Access, ADHS, the AZ Department of Agriculture, the Farm Bureau, as well as the University of Arizona Cooperative Extension. So we are working to try and get folks to utilize this line. Kind of their marketing strategy is that they understand ranching culture, agricultural sort of needs, and that they can communicate to those maybe better than the standard crisis line. So please promote that if you have an opportunity. Looking at our second bullet there, I'm excited to say that our request for grant application for counseling and community services, that is completed. We awarded to Jewish Family and Children's Services in Southern Arizona. That award was $1 million and gives them the ability to expand their services throughout Southern Arizona. One thing that I'm kind of excited about is the variety of services that go into this RFGA. It's not only going to be providing various types of counseling, not just normal sort of mental and behavioral health psychotherapy, but also grief counseling, sort of relationship counseling, career counseling, all those different types of counseling, but as well as like grocery assistance and help purchasing or gifting home medical equipment to applicants. So great range of services there, and we're very excited to be able to participate with that. All right. Also, too, for those who have been following these updates for a while, you know, we had a request for grant application for suicide capacity and logistics building. We started that project in December of 2022, and it's just a very difficult grant application to get across the finish line, but we have done so. All the awards have been finalized, and you can see the list of applicants there that were awarded. We've got 10 of them, and some of them have multiple projects per each award, just due to the nature of the grant. So altogether, between those two RFGAs here over the next year or so, we'll be pushing about $1.5 million out the door to the various awardees to do their suicide prevention work. So pretty happy that that is we're into the project phase now and out of the application phase. All right. Getting to the conclusion here, last couple of updates. I wanted to talk about some of our projects and maybe some of the questions people might have due to the current federal environment. We owe our stakeholders our 2025, reflecting 2023 data, the suicide and self-inflicted injury report, and it is coming. There was a temporary pause on all internal reports while we reviewed the language, making sure that it was in line with current federal guidance where it needed to be, due to funding awards and that sort of thing. So that pause, to my understanding, has been lifted, or at least this report's moving forward, and we should see it here in the next month or so. Our suicide mortality review report, that one was not held up in the review process. However, it's the first statewide suicide mortality review report, so it's just taking a while. I've reviewed all the graphs and tables for this report. Right now, we're just working on the narrative language and such, but it will be out hopefully as well in the next month or two. So for those involved with suicide mortality review work, it's very exciting that we'll be able to consolidate all of our county teams' data and recommendations into one report. We have two sources of federal funding. One I mentioned here, the Garrett Lee Smith campus-based suicide prevention grant that we work on with Department of Education, the Intertribal Council of Arizona, and Cochise County Department of Education and their superintendent. You can kind of see the highlights of what we're doing there, but the idea is that this one has passed federal review. And while we lost our project officer about a month and a half ago, we got another one about 2 weeks ago, and so we're moving forward. I didn't put the other federal funding opportunity on this because that one wasn't interrupted at all, and that's going to our suicide mortality review work, and that one's through the Department of the VA. So good to know that our two federal sources currently are uninterrupted and moving forward. You see our disproportionately affected population work is continuing on. And while we had a brief pause on that, while we could consider sort of the new guidance around federal guidance around DEI, we're happy to note that we can continue our population-specific work moving forward. So there you see our different work group meetings, and if you'd like to participate in any of those, please contact me. I'd be happy to include you in the listserv or the meeting roster or both. All right. So I think that that concludes my updates. Bring us here to the question and answer period. If anybody's got any of those, I'd be happy to address them.
Josh, I have a question. The NSSP, were you getting the data in real time from the emergency rooms? You said that's from the CDC. Is that going to be interrupted, do you think, with the changes happening with the CDC and the layoffs? Are we going to still be able to get that information? That information is really good information.
Yeah, that's an excellent question. And the answer is, I don't know. I would love to say that because this information is so important, it won't go away. But just myself and my epidemiologist work together pretty closely, and she's been tracking all the federal data sets that have been pulled down. There's been over 2,000 of them, right? And so while I would love to say that NSSP will move forward, I can't say that with certainty.
And do we in Arizona have a way of doing something like this just to collect the data here in our state? Do we have can we get this type of program without curiosity?
Well, it's not impossible, right? If the NSSP were to shut down, we could do it. Now, could and it being feasible are maybe two different things. But with all the hospitals being used to already reporting, that part of it is in place. We would have to redirect their reporting to ADHS and then figure out how to automate that system and have it report out back visually the same way that the NSSP does. But again, we have a lot of those pieces in place. It would just be creating the new database here in Arizona that would be the challenge.
Anyone else have questions for Josh? It's good information.
Yes, no questions, but that really was very helpful information. Thank you.
Josh, is this PowerPoint okay to be put under our news tab on the mental health parity website?
Absolutely. If you want to link the PDF version, that's totally fine.
We can do that. I think it's good information to share out to the public as well to see what the progress going forward, the stuff that's decreased and stuff that we still need to work on. Help get the public involved as well. So thank you.
My pleasure.
Good. Next is you covered the crisis stuff. I wanted to share just a blurb from the DOL report to Congress. It's not letting me share, so I will just share. So for the CMS reporting period, they sent out 22 initial letters requesting comparative analysis for 22 different, for 12 distinct NQTLs. So as they were reviewing different NQTL reports, they didn't have enough information for 12 and sent out letters for requesting more information. There were 10 insufficient letters covering 10 NQTLs sent out. To agencies, there were 19 initial determination letters finding that plans were in violation of MHPAC on 19 different NQTLs. And then they sent out 3 final determination letters of noncompliance. And so the report on Congress is 142 pages long, and it details, goes into detail about what the violations were, which NQTLs they were looking at very closely, that they had to ask more information on, and what the violations were. And so if you want some light reading in the evening time, again, it has a lot of robust information in there about violations and trends over the past year.
So a question on that, does the report, show like state by state, specific insurance companies or what?
So I've skimmed through it, and they did identify some specific insurance companies. And the one that I saw, I'm maybe a quarter of the way in, it was a company on the East Coast. And so not a familiar company. So it was a specific to that state.
So we don't know if any of these are Arizona issues.
Well, I haven't sent out any letters, so it will come from us. So it wasn't any from Arizona.
Okay. All right.
None from Arizona.
Thanks.
No, we are good. I would have said something unless they have reported and they didn't notify the department, but I would hope that we'd be involved, but no, none from Arizona.
Okay.
Any other questions about the report? Okay. I think that is it. As far as any more federal updates, I participated in NAIC this week. And just kind of as Josh also mentioned, with things happening so fast, we don't have any information of anything specific related to MHPAC just yet. We are watching for it. I'm trying to stay abreast of it to see if we do need to modify anything. I know Mary Kaczynski is on, and so if we do, she's helps to write our rules and addendums. So if anything were to come up, we would put it in that news area, like I said. But as of right now, we haven't heard anything defining coming out of the federal government in relation to MHPAC or any specific changes. I don't know, Mary, if you've heard anything.
Well, Lynette, I did look at the overview that they issued, which is 500 pages. And, the changes that have been made. I had
Mhm.
heard though that the feds were being sued on the rule changes, so I don't know what the status is of that. But that is probably one of the rulemakings I will try to start this year at least, and getting going on it. A lot of the change, I've only gotten through the definitions portion at this point, but I know there have been changes on NQTLs, and so it's on my radar screen, and I will definitely keep it there, and I may contact you, Lynette, on where we are on um, any challenges to the federal changes.
Perfect. Thank you. Anyone else questions about federal updates, changes, concerns?
Hi, this is just, I don't know why my computer is blurry, so sorry about that. Yeah, I've looked at the lawsuit a little bit that was brought by the employer groups, and I don't think anything significant has transpired. A lot of the press has been about meaningful benefits standard that doesn't kick in until next year. But I was looking, and I think plans are concerned about the fiduciary certification that's required for employer groups. Because it is, it's very broad, and given the press about that lawsuit, I wasn't sure if that would be part of their complaint, but it is, as well. So they're seeking to vacate that rule in addition. So it's going to be interesting to see how that lawsuit progresses. So.
We will all have eyes on that, how it moves forward or stay stagnated. We'll see. But we'll try to make sure that, again, I want to try to keep up as much as we can and keep everybody informed. So thanks for that input, Vista. Anybody else? Questions, concerns? Did everyone see? Actually, let me backtrack real quick. Since we're talking about that, the telehealth rules there was an open call. Let me make sure that it's not closed. And this is also on the website. So telehealth, the DA had proposed some new telehealth rules around prescribing substances that you have to see. There's a registration component. Let's see if I can pull this up too. Josh, can you go to your thing and stop presenting so I can present again?
Yeah, I'm sorry. I thought I did. I hit stop share.
Or like
Huh. Let me just leave. Maybe that'll solve it. I'll be right back.
Okay. There we go. For controlled substances, so just some highlights. Perhaps, and some of this is not going to be major changes, but it could slow down the process because they're creating this special registration. But it is open for public comment still. So, the requirements of the patient having to be seen, but I think that whatever they rolled back during COVID about softening the restrictions and how often you had to see patients on controlled substances, it looks like they're going back to the original part of the telehealth to make sure to just to have oversight, but it can slow down the process for an access to care for people with that get ADHD meds and anxiety. And I posted this on the website because it could, at some point, maybe someone may think it's a MHPAC violation, but just to make sure everyone's abreast that is open for public comment. So I don't know if anyone has any questions on that. Oh, I think that's it. Our next meeting is scheduled for May 22nd, 2025. Any questions, concerns? Vista, I see that you're off mute. I don't know if that is just still you're off mute if you had a question or a comment.
No, sorry, I just didn't click it off.
No,
Sorry.
that's fine. Okay, I will send out the email for vacancies for you guys to share with colleagues and friends so we can get these positions filled, which would be great. And I thank everybody for coming out. We finally had a meeting. Good information. Josh, thank you for your presentation. That was excellent stuff. I'd like to hear that some numbers are going down, but I know we still have a lot of work to do. So if there's nothing else, I will consider the meeting adjourned at 12:50 p.m. and everyone else can enjoy the rest of your day.
Thank you.
Thank you.
Thanks, everyone.
Thank you.
Thanks, Lynette. Go Michigan State.
Yes, go Michigan State.